Hi, I'm Dana Pierce, and this is the demo of the clinician side of Spiro Institute. So this is the login. Sign up. You'll verify your email with a code that you receive. Then you'll come in, and this is the patient or the clinician dashboard. So here we see the schedule for the day. You can click on this link and go immediately to that appointment. You'll also see all of the urgent tasks and urgent messages that have come in. Can go to the patient cards. So this allows you to see all of the patients in the program and provides a small summary about them. So their age, gender, level of care, date of birth, their assigned psychiatrist, primary therapist, when they last saw them, and a brief summary of what happened during that appointment, including a recent group therapy session, and then their diagnostic codes. If you want to add a new patient, you'll see a blank card and you'll immediately start a patient intake. So this is an 11-page intake. It's very thorough. This is general information, general screening, presenting concerns. This is the suicide risk assessment, which is the Columbia Suicide Risk Assessment. Mental status exam. Each of these can be selected and added to the patient's chart about how they're presenting. This is their treatment history of hospitalizations, medications, providers, mental health history, trauma history, eating disorder history, and substance use, physical health, family and social support history, legal status, financial status, housing and education and employment background, and hobbies and interests, strengths, and barriers. If you want to see a patient's current chart, you can see that when you click on their card, it expands over here. You can see critical clinical tasks that need to be performed for this patient, and you can also see some insurance information here. These are all of their most recent appointments. You can see the documentation from these appointments. You can also see the patient's treatment plan here. This is all of their most recent goals. You can edit the treatment plan. So you can go in here and add new goals and track their goals progress. This is also where you would fill out a patient safety plan. These are the assessments that are assigned to the patient based on their diagnosis. Each of these assessments are taken every other week. You can see the most recent assessments and past assessments, individual answers. You can also see the score of the assessments over time on a graph. These are documents that the patient needs to sign for consent. You can also upload a new document. These are tasks that are critical to clinical collaboration. So you can see this patient's being treated by multiple doctors. So we want them to be able to discuss tasks related to this patient. So you can see psychiatrist Dr. Jones assigned this task that's urgent to the therapist Walter Perlman. They can have comments here about the task so they are able to consult on it. Also, when the status of this task is changed to completed, the provider will be notified. You can also add a new task here. Here is the DBT tracker that patients fill out daily. So every day they're filling out physical symptoms, they're filling out urges, they're also filling out intensity of emotions. This can be customized based on what the patient needs. You can also see the information about emotions tracked on a graph. You can also see what skills the patient has been using, how often they're using it, and how effective these skills are for them. You can also change the skills that they're tracking. So this helps track what skills are the most effective for this patient and inform care. This is where we do medication management. You can add a new medication. You can see past medications, can see what's available for refill. You can also discharge the patient directly from here. This is the discharge summary. This is why the patient is being discharged. Summary of the treatment the patient received and aftercare about where the patient will receive treatment next. Next, we're going to go to documentation. So this is so that the clinician's documentation can all be in one place. This is the individual documentation. So these are all of the patients that Walter Perlman is responsible for. So Lori Briggs, for example, we can go in here, go to her most recent appointment with Walter Perlman. These are the psychotherapy notes that are just rough notes that he took during the session, going to convert them to official clinical documentation. Go through here, fill out all of this mental status exam. You can see the psychotherapy notes present here, which will help fill out the SOAP notes. Once you press submit, this note will be public to everybody who has access to her chart. You can also see other people's clinical documentation, like psychiatry notes, group notes, other notes. So this would be like dietitians, nurses. We also have all of the groups that Walter Perlman is responsible for. So for example, the IOP DBT group. This would be the most recent group that took place. These are just going to be rough notes he took during the group, convert them to official documentation. That's shown here. That previous psychotherapy note is shown here, but it will disappear when this note is published. That's used to fill out this general information, which will be present in all of the patients' note from this. And then each individual patient that was present in group has a small section here that's filled out, and only their summary will be available on their chart from this group. Once this is completed, it's available to everybody who has access to their charts. So just to show you, for example, in Lori's chart, what that group note would look like that we just generated, it would show this area, these sections that everybody had, and then just her individual patient information. Then we'll go to messaging. So this is a group chat with all of the therapists, a general message board. Then you can see clinician to clinician messaging. So this is for consults. You're able to schedule a consult here. You can assign a task here, say what patient's for, who you want to perform it, when it's due by, add the task. You can even view the task directly in that patient's chart. Then you can see patient messaging. So this is a group message for the Monday PTSD group. All the patients can message in here. Walter Perlman can also pause this chat in case something inappropriate is taking place, and no one will be able to message in here until he resumes the chat. There's also one-on-one patient messaging to the clinician. So they can send you, for example, blood work, or they could send you a therapy assignment they're working on. You can also schedule an appointment directly from here. Billing, this shows you the patient's summary of benefits from their insurance. And then this shows you the amount of money they've been charged, when it was charged, and what card it was charged on. This is scheduling. So you can see scheduling is color-coded, shown on a weekly schedule. Individual appointments, you could go directly to the link. This will show you the pre-session survey that the patient filled out before the session. You can see how they're feeling, what they want to work on. You're going to meet with the patient. Once the call's over, you'll see their post-session assessment, so you can see how effective the treatment was for the patient. Also, you can access your groups from here. So press this link, take you directly to the group therapy. Also, you can directly access the documentation for this group. Go ahead and complete it as soon as you're done with the session. Then, of course, you can schedule appointments with anybody here. Lastly is settings. So this is where you could change your personal data, your photo, your ID card. You can change profile settings, working hours that will show up in messaging, and then edit your password or receive customer support. Take the logo and it takes you back to the home dashboard.